You are likely walking into your kitchen every single morning and pouring a glass of something you have been told your entire life is a superfood. You drink it because you want strong bones. You drink it because you were told it is heart healthy. But while you think you are nourishing your body, you are actually pouring fuel directly onto the fire of your prostate growth. You are spiking a specific hormone that forces your prostate cells to multiply, closing off your urethra and forcing you out of bed 5 times a night. Today, we are going to expose the single drink you must eliminate to shrink your prostate, and exactly what you must replace it with to reclaim your sleep and your dignity. My name is Dr. Emily Carter. I am a board-certified urologist with over 25 years of experience treating men's health issues, specifically focusing on the complex hormonal shifts that occur in men over the age of 60. I do not follow the standard government guidelines because, frankly, the standard guidelines are what got most of my patients sick in the first place. I specialize in the root cause, and often, that root cause is hidden in healthy habits. Let me tell you about a patient of mine named William. When William walked into my clinic, he was 64 years old, and he was exhausted. He looked 10 years older than he actually was. He was a disciplined man. He did not smoke. He rarely drank alcohol. He exercised 3 times a week. Yet every night his bladder would wake him up at 11, then 1, then 3, and again at 5 in the morning. He had a weak stream. He had dribbling, and his PSA levels were creeping up into the danger zone. William was frustrated because he thought he was doing everything right. When I looked at his diet log, I saw it immediately. Every morning, William had a large bowl of oatmeal made with skim milk and a glass of low-fat milk on the side. He believed, like millions of other men, that he needed the calcium for his bones and that removing the fat was the healthy choice for his heart. He did not realize that this specific white liquid was the primary driver of his prostatic hyperplasia. We need to have a serious conversation about the enemy. The enemy here is commercially produced cow's milk, and specifically, skim or low-fat milk. I know this sounds controversial. I know you have been told to drink 3 glasses a day. But let us look at the biochemistry that most general practitioners ignore. The prostate gland is extremely sensitive to hormones. You likely know about testosterone and dihydrotestosterone, or DHT. But there is another hormone that is just as critical, called Insulin-like Growth Factor 1, or IGF-1. IGF-1 is a growth hormone. Its job in a child is to help them grow into an adult. But in a man over 60, you do not want growth. Growth in the prostate equals blockage. Growth in the prostate equals cancer risk. Dairy products are designed by nature to turn a 60-pound calf into a 2,000-pound cow as rapidly as possible. They are packed with IGF-1. When you drink milk, you are flooding your system with this growth signal. Now, why is skim milk worse than whole milk? This is the contrarian truth. When you remove the fat from dairy, you alter the absorption rate of the lactose sugar and the proteins. Without the fat to buffer digestion, your insulin spikes sharper and faster. High insulin triggers the liver to release even more IGF-1. So, by trying to be heart healthy with low-fat dairy, William was creating a hormonal storm that signaled his prostate to grow, swell, and suffocate his urethra. But it is not just the milk. The second enemy in your glass is often commercial orange juice. Men over 60 often drink this for immunity. But fruit juice is essentially liquid fructose without the fiber. Fructose induces inflammation and oxidative stress in the prostate tissue faster than almost any other sugar source. If you are combining a glass of skim milk with a glass of orange juice, you are creating a cocktail of inflammation and growth factors that no amount of saw palmetto supplements can fix. So, if we take away the milk and the juice, what are the heroes? What can you drink that actively reduces the size of the prostate and lowers inflammation? The first hero is green tea, but it must be prepared correctly. Green tea contains a catechin called EGCG. This compound has been shown in clinical studies to induce apoptosis, which is programmed cell death, in fast-growing prostate cells. It also inhibits the enzyme 5-alpha reductase, which converts testosterone into the prostate-enlarging DHT. It works similarly to the drugs I prescribe, but without the side effects, if taken in the right dose. The second hero is pomegranate juice. But it must be 100% pure, not from concentrate, and in small amounts. Pomegranate is rich in L-gitannins. These compounds interfere with the blood supply to abnormal tissues. Think of it as starving the growth. The third hero is a powerful combination of tomato lycopene and fat. Lycopene is a carotenoid that accumulates in the prostate and protects DNA. But here is the secret. You cannot just eat a raw tomato. You must heat it and combine it with fat to absorb the medicine. Now, I am going to give you the specific protocol I gave to William. This is the Prostate Reset protocol. You need to follow this for exactly 6 weeks to see the results. Step 1 is the elimination phase. For 30 days, you will consume 0 dairy. No milk, no cheese, no yogurt, no cream in your coffee. If you need a milk substitute, use unsweetened almond milk or macadamia nut milk. You must also eliminate all fruit juices. Eat the fruit, do not drink the juice. Step 2 is the morning elixir. Every morning, instead of milk or juice, you will drink 12 ounces of warm water, mixed with the juice of half a lemon and 1/4 teaspoon of turmeric powder. The turmeric lowers systemic inflammation, effectively cooling down the irritated prostate tissue. Step 3 is the midday support. You will drink 2 cups of high-quality organic green tea between noon and 2 in the afternoon. Do not add sugar. If you need sweetness, use a drop of stevia, but preferably drink it plain. Step 4 is the evening shield. At dinner, you will consume 1 tablespoon of pumpkin seed oil. You can take it off a spoon or mix it into your salad. Pumpkin seed oil is rich in beta-sitosterol and zinc, which are the building blocks of prostate health. Step 5 is the timing rule. This is crucial for your sleep. You must stop all fluid intake 3 hours before bed. If you go to sleep at 10 o'clock at night, your last sip of water is at 7 in the evening. This allows your kidneys to filter your blood before you lie down, reducing the pressure on your bladder during the night. Now, let us talk about synergy and sabotage. What makes this work better, and what destroys it? Synergy comes from fasting. If you can push your breakfast to 11 in the morning, giving your body a 14 to 16-hour fasting window, you lower your baseline insulin levels. Remember, low insulin means low IGF-1, which means the prostate stops receiving the grow signal. Sabotage comes from alcohol, specifically beer. Beer is double trouble. It contains alcohol which irritates the bladder lining, acting as a diuretic, and it contains hops. Hops are highly estrogenic. As men age, our testosterone drops and estrogen rises. This imbalance contributes to prostate enlargement. Drinking beer is like pouring estrogen directly into your system. If you want to heal, the beer must go, at least for this 30-day reset. So, what happens when you follow this? Let me tell you the resolution of William's story. In week 1, William struggled. He missed his milk and his cereal. But by day 7, he noticed his daytime urgency was reducing. He wasn't rushing to the bathroom every hour. By week 3, the inflammation in his body had dropped significantly because he wasn't spiking his insulin with skim milk and juice. He told me he slept for a 4-hour block for the first time in years. By week 6, we retested him. His PSA had stabilized, but more importantly, his International Prostate Symptom Score, which measures quality of life, had dropped by 50%. He was waking up only once per night, which is normal for a man of 64. He had his energy back, he had his confidence back, and he did it not by adding a new pill, but by subtracting a poisonous habit. Here is my challenge to you. I want you to commit to the no dairy, no juice challenge for just 30 days. That is 4 weeks. Replace your morning milk with the turmeric lemon elixir. Replace your afternoon soda with green tea. Take the pumpkin seed oil. Your body has the capacity to heal, but you have to stop feeding the disease. You have to stop listening to the marketing that tells you milk does a body good, and start listening to your own biology. My name is Dr. Emily Carter. I want you to try this protocol and then come back and tell me how your sleep has changed. Thank you for watching, and stay healthy.